everybody, welcome to the 18th edition of John News. This is a special healthcare edition of John News. My name is John Wortman, and I'm coming to you from my deck in Chapel Hill, North Carolina. I am doing well. And now the news. Dr. Betsy Tilson is North Carolina's State Health Director and Chief Medical Officer. I'm going to talk to her about coronavirus news. Hi, Dr. Tilson. I hope you are well today.
Hi, John. I'm very well.
This week I'm going directly to an expert. Can you give us the latest news headlines about coronavirus?
We are starting to see some decreases in our cases and decreases in our trends, which is a really good thing.
Yeah, very good. I have not been in school since March 13th. Why are so many things closed?
Yeah, so really, we are all living history now. So when you're going to look in your history books in 10 or 15 years from now, we will all be living history. And that's because this is a brand new virus that wasn't even on this earth before December of last year. And so that means nobody was immune to it. Everybody could get infected by this virus. And so the way people get infected by this virus if they're around other people. And so many things have had to be closed so that people don't get around other people, and it's a way we can prevent that spread of the virus from one person to another.
I think that's a very good idea. Do you think we are going to get a vaccine? If so, when?
I do think we're going to get a vaccine, and I'm very, very excited for when we get a vaccine, because that will be the way that we really can prevent and control this. I am hopeful that we'll have it as early as the beginning of next year, and that will make me very happy, because the best way to protect people is to prevent them from getting the infection in the first place.
Yeah, I think it'll make me happy too. Is there anything else you want to tell my viewers?
I just want to say, so although we've had good news, it's still fragile, and since we don't have the vaccine, we have to have everybody practice prevention in those 3 W's. So always wearing a face covering when you go out, that will help prevent that spread. Washing your hands really well, and then waiting 6 feet apart from each other. Those 3 W's, prevention, incredibly important, especially until we have a vaccine.
I like those ideas. Thanks, Dr. Tilson. I know you're very busy, so I'll let you go now. Bye!
Hi, thank you.
Also in the news, a lot of people are wearing I Heart John News t-shirts. For example, my friend's dad, Yang, wore his I Heart John News t-shirt when he went fishing. One of the teachers at my school, Miss Raffetto, wore her I Heart John News t-shirt when she taught class from her home. If you send me a photo of you or video of you wearing your I Heart John News t-shirt, maybe you'll get on my newscast. And now, the weather. Today, there'll be a high of 93 and low of 71. There's a 7% chance of flying pigs. Hey, there's one now! Anyway, I think that's about right. And now some good news. Even during coronavirus time, there are a lot of workers who keep working to help other people. One of those workers is Dr. Dee Arnold, who is an emergency room doctor at Kaiser Downey outside of Los Angeles. I spoke to her on Zoom. Hi, Dr. Dee. How are you doing today?
Great, John. Thanks for having me on.
I'm glad to have you on. What's it like to work in an emergency room right now?
The emergency department is always wild and crazy and busy, but since the coronavirus pandemic, things have been a little bit different. We spend a lot more time cleaning. Everybody wears masks, which is new. And we spend a lot of time keeping our patients distanced from each other so that we can keep them safe.
Yeah, I think it's a good idea to do all those things. Doctors are some of the helpers that still work, even during coronavirus time. Why do you keep working in a dangerous job?
That's a really good question. You know, when I decided that I wanted to go into medicine and become a doctor, I did that because I really wanted to help people, and that's an important part of our job. So even though it gets dangerous sometimes, it's still part of the things that we signed up to do. And, I think a lot of the other people that I work with feel the same way. I also take a lot of pride in what we do. We take care of our community and those around us. And I think that we provide a really necessary service. And so I'm really happy to be there. Even though sometimes it gets a little dangerous, we do everything we can to protect ourselves.
Yeah. Is there anything else you want to tell my viewers?
Well, I guess I'd just like to say that, the last couple months have been really different for everybody, right? For you learning from school at home, lots of people working from home, having to socially distance and wear masks. But, I think that all those little things that we do, they really do make a difference. So I really want to thank everybody for taking the time out of their day to do those things.
Thanks, Dr. Dee, and thanks for being a helper. Bye! Thank you to all the helpers who help us during this strange time. And that's the good news. Until next time, this is John Wortman signing off from John News. So long, everybody. Bye!